since the last ice?
No, I don't, but it would be some time, some significant time. It would be months, I would think. But I can, if we can provide any further information just for the historical context, we will.
Have you got any more advice on if we are accepting that the virus is a bit?
No definitive advice, but there's a working theory and very significant concerns about aerosol transmission, particularly of these hyper-infectious strains. They do present us with a very significant challenge. National Cabinet had a discussion on Friday. I see some commentary today about hotels aren't the go and all that. Well, that's not the decision of National Cabinet. There's no federal facilities that are going to pop up anytime soon. So we have to make the best of what we have, and we have to just push forward. And whilst we're grateful for ADF's support, it's relatively modest in the scheme of things, and we are a bit disappointed that we didn't get the additional roles and functions that we asked for. But, we just push forward, and I can foreshadow for you that we're not going to anywhere near the capacity that New South Wales has or other states have, and I don't make any apology for that. We will have less capacity because we have a different model and, I believe, higher standards. We are moving to test staff members, every staff member, not just when they work, but on their days off as well. And I'm very grateful for the very cooperative way in which the staff have worked with us. This is as much to protect them and their family as it is to protect all of us. But, this is as I've said so many times, this is not static. It's dynamic, it's changing. It's very different today from a challenge point of view than what it was 2 or 3 months ago. And unless and until we get everybody who's vulnerable in the first instance, get them the jab and then have a much bigger percentage of the community through that program, then this is just going to be risks that we have to manage. That's why it's so important that people get tested when we ask them to, when they register those symptoms. And it's so important that we're able to today say to you, there are no staff that have tested positive. And the reason I can say that is because we test them all. And we're now moving to test them not just when they work, but when they're not working. That's not easy, but it's a really important safeguard, if you like. Just like wearing masks inside is not the most pleasant thing you'll do, but again, it's a safeguard, it's insurance, it's just that extra layer of protection.
So do you agree now that there was a gap somewhere in the current hotel quarantine scheme where it was handling old virus, if I can put it that way? There's a gap now that isn't handling UK variant or more virulent strains, and you're trying to find what that gap is?
Yeah, I wouldn't put it exactly in those terms. What I'd say is that as the virus changes, then our public health response has to change. And, just to give you a flavour of this, so we've had engineering reviews of all the air conditioning systems in all the hotels that we use. We've ripped out the air conditioning in a number of these places and put new systems in. We've changed the way air flows. We rip up the carpet in all the common areas. No one else does this. We rip up all the carpet in the common areas, so hallways for instance, and lino is put down so we can clean shared spaces where there could be a transmission to industrial standards. There's 50 other points where we do things differently, sometimes significantly differently, sometimes it's a smaller thing. But when you add all that together, it's a very risk-averse model. It needs to be, and I can't rule out further changes. We've had the rest of the country copy what we're doing, or at least commit to. I'm not sure how many have actually done it, but they've committed to do it. But we're looking to change again, so there'll be even further work for other states to do, like this whole issue of day 16 testing. We're working with New South Wales on that, given we've seen a couple of cases that are presented as positives very late in what would have been, and indeed beyond the 14 days, and these issues about airborne transmission. So as the virus changes, our systems have to change, and I suppose my message to the Victorian community is they can have confidence that we're always looking to be a step ahead of this virus. We're always looking to have the best model in place, and I can't rule out that there won't be further changes next week or the week after. We'll keep making changes on the best advice to try and stay a step ahead of this.
How can you say that Victoria has higher standards than New South Wales when it comes to hotel quarantine, when New South Wales is taking more return travellers safely a week, and we've had 2 leaks in the last week?
Well, I can say it because it's true. And whether that's convenient for people or not is not really my concern. There's not 3,500 private security working in our system. Do I need to go any further than that? If I was to align many of the criticisms that have been levied with over a long period of time with what we do now, I'm very confident that we have a system that is worthy of being copied by others, and it is. If it was anything other than leading, and this is not about boasting, so this is just a fact. if it was anything other than one of the best systems, the AMA over in WA were calling it the gold standard. They're not terms I use, but that's what they said. If it was anything other than a good system, then I doubt very much that other First Ministers across the country would have agreed to copy it. So, again, I've been pretty clear with you and with others that it's not a matter of if, it's a matter of when. That's how hyper-infectious this is. The fact that we're able to find these quickly and act on them just as quickly, but also at the same time be able to say to you and to your viewers and to every Victorian, and indeed every person across the country, that there's no other staff with this because we test them every day. That's just one example among many. It's not a point of criticism of anyone else. They can speak to their systems. I'm simply making the point that we will not be getting to 3,000 because I don't believe 3,000 would be safe. That's my judgment, and I'll be accountable for that.